It is just a huge honor for me today to be podcast interviewing Dr. Nada Albatish, DDS, who owns and operates a multidisciplinary practice, All Smiles Dental Center, just north of Toronto, ranked one of the 500 fastest growing companies in Canada. She serves on faculty for Clinical Mastery Series and is currently launching an exclusive online business training program for dentists called the Brilliant Practice Mastermind. As a passionate learner, she first completed a one-year GPR, followed by hundreds of hours of CE each year before she started working in dental education. Nada started her current practice from scratch as a solo practitioner and quickly realized she needed a strong support team, as well as a team of skilled doctors in multiple specialties to help her achieve her goals as a comprehensive dentist. Today, Nada niche is complex and rehabilitative dentistry, supported by a team of 30, including general practitioners and specialists. She is passionate about what she can do for patients, always excited about training and advancing her team, and she is energized by sharing with her colleagues. She loves to create opportunities for her patients, team, colleagues to help each run further than the success they thought possible. She is an entrepreneur, clinician, educator, author, and loves to help dentists achieve excellence, predictability, and confidence in their craft. She is committed to the success of her patients, colleagues, and advancement of dental profession at large. It is just a huge honor to have you on the show today. Thank you so much for coming on the show. How is All Things Toronto doing?
Excellent. Thank you so much for having me on the show, Howard. I'm a big fan.
Oh, thanks. You say you have three work passions: functional and cosmetic dentistry, the business of dentistry, and dental education. And I wanted to know, how long was it before you graduated, before you were an owner-operator of your own office? How long did that take?
So I graduated in 2007. I did a GPR for a year. And in 2009, I opened my first practice. So it was 2 years from when I got my DDS.
And 1 year from your post-grad education. What I don't understand, it seems like my generation, I'm 57. Please don't tell me I'm younger than I'm older than your dad. It seems like
You're not.
It seems like we came out of school and just opened up our own practice. But today it seems like so many people graduate and they have 5 or 6 or 7 different associate jobs in 5 years before they finally say, I'm so miserable, I'm going to open up my own. Why did you agree with that they're taking longer to open up their own practice?
You know what? I do. I've definitely seen that trend over time myself. I think it has something to do with the rising school debt as opposed to what it used to be before, and people getting things under control in their own lives before they move on to sort of the next step. And the investment in practices now is a lot more than it used to be even 20 years ago or 30 years ago. So I definitely think it's something people are taking time to do. But one piece of advice that I give doctors, just based on what you just said, they're opening practices when they're just miserable enough to want to work for themselves, is that if that's the goal, like you're miserable and you just want to be your own boss, and that's the reason you want to open your practice, you're buying yourself a very expensive job. So a dental practice is a business. So I think having a passion for running a business probably sets you on the path to success.
That business mindset, that's let's talk about that. Do you think some people are saying that one of the rises of DSOs is because a lot of dentists who graduate today don't have the business mindset like they might have 30 years ago? Do you think 30 years ago when I got out of school, more dentists had a business mindset than in 2020?
That's a really smart question. I would be surprised if that was the case. I think that if you look at every industry, I think dentistry is just a little late if you compare to other industries when it comes to business. So private practices in medicine and pharmacy actually saw the corporate world before dentistry did. So I don't think that DSOs coming in the more recent future has to do with 20 years ago, people being better business people and not being as good business people now. I think that we all graduate from school without business training. I think you get a dental degree and you have a license to potentially own a multi-million-dollar business if you can do it right. And in that, you're basically a CEO and you have no business training. And I think that was always that way.
So Before we get into next question, I think it's a timely question. Smiles Direct Club is probably going to go public this week. Their IPO is all set for this week. How does the business of ortho and something like Smiles Direct, how does that set with you? Oh.
Well, that's a really big topic, Howard. That's a really big topic. And I'll say that I think doctor-directed orthodontics is more professional and ethically responsible than non-doctor-directed orthodontics. But I mean, it's a huge business. The IPO I saw last week on the news is set at $1.4 billion. So there's clearly a market of going direct to consumer. What I'm doing and what we all are doing if we're operating a dental office is a completely different business, and it has a completely different value to the people that you're actually helping. And that's sort of what I focus on.
You know, I when you're my age, you've seen every rodeo for the second or third or fourth time. There's almost nothing new. So I lived through this rodeo when every dentist back in the 80s had a great bleaching business. Omni Pharmaceutical out of Arkansas came out with a carbamide peroxide 10%. Everybody was bleaching for like $250 an arch. It was a big business. And then Crest Clear Strips came out for $50 over the counter. And it's just competition. We were probably charging way too much at 500, and that brought it down. But you know, it's just competition. I think competition is good for all markets. When you got out, you say your three work passions: functional and cosmetic dentistry. Where does that come from?
Well, that's been a long journey in education for me to learn about occlusion. And so where that came from is that when I graduated from even not just school, but also my GPR, I was really confident in single tooth dentistry. And so that's everything you learn in school. It's caries and perio and treating every tooth for what you diagnose in that single tooth without really looking at the entire system, how it all relates to each other, how it's working in the body, how things are breaking down as a function of being related to each other. I mean, one tooth is not in a standalone sterile environment. It's in a mouth, which is part of a muscular system, which is part of a body that can have other issues that are impacting the health of the teeth. And so slowly over time, I started to see those things and see some of those breakdowns and really want to help my patients more. So I went and I started on a path to learn about occlusion. And my husband would say, like, what is occlusion? And I'm taking these courses and I couldn't even answer the question. I'm like, I think it's the bite. That's what occlusion is. But what I learned over time is what it led me to is really, it's about wellness. It's about being able to do dentistry that works and that lasts longer and is more predictable.
And you know, when they come out of school, that's kind of where they are. They need to come out and start practicing. You know, it's like football. You need your basics: a pass, a catch, you know, a tackle, a block. They need to come out and do a filling, a crown. Just the basics. How far along when they get out of school do you think they're ready to start the journey from one tooth dentistry to quadrant to arch to full mouth?
I think that it's going to be dependent on the person. I think that once you're comfortable, and everybody takes different amounts of time to get to comfort, but once you're comfortable, once you're competent, you're unconsciously competent of what you're doing. You don't have to think about it. Remember the first time you gave an injection? I remember the first time I gave an injection. It was to my best friend in school. My hand was shaking. I was terrified to do it. That was maybe didactic confidence, but not clinical. I was very conscious of every step I was taking. A couple of years later, I give an injection, I don't even have to think about it anymore. And I think once you get to the point in single tooth dentistry where you're unconsciously competent and confidently doing what you're doing, then it's probably time to look at the next step. And one way to speed that along, like you don't have to take 10 years if that's what it would take you without education. One way to speed that along is learn.
Yeah, I like that unconsciously carries perio. I loved your article in Dental Town because it just hits the nail across the head. So many people, most dentists, your article is called "I Don't Sell Dentistry: A Doctor's Mindset" by Dr. Nada Albatish. February 2019, and I had a lot of debate after it. And the bottom line is, I mean, I've been a dentist for 32 years. If I ask any dentist, would you like to sell dentistry? They all say no. And it's like, wow. I mean, the average American will buy 13 new cars between the ages of 16 and 76, and the average car price will be $33,500. And then 95% of dentists will practice their whole career without ever even presenting a full mouth. Let's read it. So talk about your article. I don't sell dentistry, a doctor's mindset.
So this article, first of all, thank you so much. Thanks for allowing me to publish that, and thanks for the real positive feedback. I'm honored to have been in the magazine. So this article actually stemmed for me from a conversation I had with a colleague I respect very, very much. And I bumped into him at an educational event. So we had both signed up for a course, and we didn't know that we were each there. And he said to me, "Oh my goodness, like you're just like selling stuff all the time, and he was kind of talking to me like that, and I was taken aback a little bit. And I said to him, we need to have a conversation. I don't sell dentistry. He knows though, and he's worked with me for a long time, so he knows the kind of dentistry I do, and he's seen the before and after photos of my work, and he sees some of my patients. And so he's like, then how are you doing all that dentistry? And that's where my idea from the article actually stemmed from, is that his thought process, and I said, he's an excellent clinician. I admire him so much, but his thought process is the same as many doctors. If you're doing this, you must be selling. You must be, doing something to push this stuff on people. And I find that actually kind of offensive. And that's where my title came from. I don't sell dentistry. What I do is I actually connect with patients, and I can do something for people to help them on a different level than the type of dentistry that I could provide 12 years ago, the day I graduated. And I want to do that for them because I know, I'll tell you, from the first time I balanced somebody's bite, I learned how good I can make somebody feel by doing what I do. And that's what I can offer them. And if that's up their alley, that's what I'm there for. And if it isn't, my practice offers everything anyway. We're a general practice. So we can help them in any way that they want. And so that's why I say I don't like even the term case acceptance in the way it's commonly thought of in dentistry about being, low percentages of case acceptance. If you offer 10 people treatment and one person will say yes, well, if you listen to your patient and you actually know where they're at and what their goals are and offer them something, tell them everything, but really tell them what's really going to work for them at this time in their life, why can't your case acceptance rate be well over 90%?
Yeah. And there's this in every single zip code of every city in the US. You have all these dentists that blame everything on the economy, insurance, Delta, everything. And it's like, okay, well, you're in a small town, and there's this doctor in your small town who's like you, Monday through Thursday, 7 to 4, or 8 to 5, whatever. But every Friday they go in there and an anesthesiologist comes in there and puts them to sleep, and they do some big $5, $10, $20, $30,000 case, sometimes, 50. And they do this 30, 40 Fridays a year. And this guy's doing, $1.5 to $4 million a year. And you're right next door in the same medical dental building, and you've never done this one time, and you're as old as I have. And I just don't, and even the word selling dentistry, I mean, if you, what would you be interested in selling? I mean, maybe he has a bass boat, maybe he has a $90,000 bass boat. And I'm like, if that's your passion, get out of dentistry and go sell bass boats. I mean, the guys that buy these bass boats, the guys that, I've done full mouth rehabs where when she saw the mirror, she had to take a knee. I mean, just overwhelmed. It's like, why don't they believe in themselves? And sometimes I think it's you're in your article, you talk about establishing a rapport with your patients. Well, everybody except at a dental school is accepted because they got A's in math and chemistry and biology and physics. And that's not necessarily your party person in a fraternity who could go into sales. Do you think dentistry attracts the wrong mindset to establish a rapport with people? Do you think they're not people persons?
That's a really interesting question. I've heard that. I've actually heard that before. And you know what? I don't actually think so, because I think you can learn to elevate your communication skills. And I think you can learn leadership. Of course, some people might naturally be a little more apt for it, but the reality is, we've learned so much just to become dentists. Dentistry is way harder than any of the stuff we're talking about. That's the truth. Like doing a crown prep and all the details in between and doing 28 crown preps at the same time even is way harder than actually just listening to your patient and getting to know what their needs are. And so I think I've learned from some great people over the years, but I think that, you know, just having that growth mindset and recognizing that before you even went to undergrad and before you went to dental school, you didn't think the way you think now. So I don't think it's hard to shift the way that you're speaking to people by listening to people who know how to speak to people, who have learned that skill already, and really finding the right mentors.
Yeah, and you and I both know the best salesman in dentistry, Pete Janicki, who ran Dental Town sales for 10 years, and it was all just establishing a rapport, being honest, being transparent. I mean, it's so go through that. So you meet me as a new patient. What are you doing with a new patient to establish rapport that you think gets more, you're not in really a rich area, right?
No, I'm not. I'm in a very, very, very blue collar town.
So you're in a blue collar town.
Insurance.
Yeah, and I grew up in Kansas, which is the most blue collar, and they have no problem spending $50,000 on an F-150. If you got a little more money, you buy an F-250, and if you really want to rock the boat, it's a $98,000 F-350, and they sell these all over the state. And then you'll go to a dental office where every third patient pulls up in a $50,000 F-150, and they walk out getting an MOD composite on number 3 in a mouth that's tanked. So how do you do the new patient where you think you can co-discover and get them to do more comprehensive cases like you publish?
Okay, so I'm going to take one step back from the new patient. Before that patient ever comes into your practice, you need to be able to see what's wrong. What's wrong with every patient is not only caries and perio. There's more going on there. And not only do you need to be able to see that, but your team also needs to be able to see that. You know, you create a job for yourself by being the only person who knows everything and making everything reliant on you. But what I can promise you is that your team members are really smart people. My team members are smart. And if your team members aren't smart, hire smarter. But they are very, very capable of learning what you've learned so that they can actually have the same conversations with patients. So baseline number 1, get educated so that you know what you're looking at. Number 2, your patients come in my practice, the way I've set it up, because I do have a busy practice at this point. So the way I've set it up is that my team actually initiates those conversations, and I actually schedule enough time for my team members to talk to patients. It is not a factory, and it's not just about a hygienist getting in there and doing as many scale polished fluorides as possible. It's also about having some scheduled time where they can actually talk to the patient about their previous dental experiences, what their goals are, where they think they are in their dental health, and what's their ideal, like where do they want to get to? Because when someone just tells you that point blank, you know exactly where you fit in to help them get there. And so all this really boils down to is conversation. And what conversation boils down to is not just you talking above people's heads, it's also really becoming a very good listener. And that takes practice.
Yeah, the people skills. My last book was People, Time, and Money. And I even said, if you get the people stuff right, if you get an A in people stuff, you can get a C or a D in time and money. I mean, it just, if you got the right people, like you talk about the right people on your team. So many practice management consultants say that when they walk into a dental office, you can smell $1 million practice instantly. The other 99%, you think he just walked into the library. So here's Doc. He spent his 8 years in the library. You know what I mean? So when he hired his receptionist, he just got whoever reminded him of his favorite librarian. When you go to dental conferences, all the dentists go by themselves. And it's like, how do you transfer this to your team? So go back to people, time, money, your staff. Do you take your staff with you to continue education? How do you get more people that are on board with your type of practice?
So I do occasionally take my staff with me to education, depending on where we're going. It's a pretty big investment. I have a pretty big team, and most of the education I do is in the United States. So for us, it's a really big venture, and we've done that together. What I do consistently is every time I go anywhere and learn, and I expect myself to come home and implement, I schedule a meeting the week after. So if I've gone away for the weekend and I'm invested in myself, I am planning already when I come, and if I have a long flight, it's even better because I'm disconnected and I'm actually making notes and planning how I'm going to relay this to my team. And what I do is I come home and teach my team. And that makes it so that we're actually implementing what I've chosen to implement out of what we've learned. The other thing is, Howard, I have weekly team meetings, and things that I talk to my team about are things like my goals, my vision for the practice. We share together and talk about what our individual core values are and what our core values are as a team so that we're in alignment. And the other thing is, I don't really have a problem recognizing if someone's out of alignment, and whether that means that they need to change seats, maybe have a different role on the team, or whether they'd be happier elsewhere.
Yeah. The other thing I think is bizarre in dentistry is they don't see how Walgreens and Kroger make the most money in distribution. Southwest and flights. It seems like dentists only think that the only money in food is a Ruth's Chris in a rich area in Beverly Hills and Scottsdale and Key Biscayne. They don't realize how much money sits in the middle class. And I've always said that 80% of the dentists that are trying to be like you are chasing the richest 20% of the population. And if you just realize that that the middle class, sometimes they eat at Ruth's Chris and sometimes they eat at McDonald's. They all have money if you can convince them, if you share with them what's available. Sometimes they're not in the mood to read fixing up their mouth, and sometimes they are in the mood. Do you need any technology to do that? I mean, is there something technology wise like CBCT or intraoral camera, or is there something in your communication that helps you do this, or is it or not really?
So that's a really great question. And there are a lot of great tools out there. And I hear from a lot of doctors, lots of things they do, including getting cases waxed up so they can show it to the patient and sell it to them after they've done the records and the wax up. I'll tell you probably the best tool that I've ever learned and taught my team to kind of help us show patients what's possible is photography, which is super, super simple. The best thing I used is, a stitching app on my iPhone and stitching a before and after photo together to be able to show a patient what's possible. But for me, I actually just have these conversations with patients, and I don't need any tools outside of communication in order to get patients to get started. And it's just because they want it. They want it. They ask me, when can I start? And sometimes the challenge becomes, how soon can I get them in? And am I traveling to teach?
On Dental Town, one of the most impressive dentists known to man is Velo Greek, and we've had him on the show, and he says after your article, such an impressive read, the maturity of a professional learned earlier rather than later. Please take the time to read Nada's bio, then read it again. There is a reason for her success. Again, these kids come out of school, they're $274,000 in student loans. They think, I already paid for the dental education. What would you say to a kid who just got out of dental kindergarten 3 months ago and says, I don't have the money to keep learning. I already did that for 8 years. That part's done. Now it's time to go get a job as an associate and start paying back that student loans. How was your mindset to keep going, to keep learning, to keep pushing?
So I love that question. And I've been asked that so much within the clinical mastery courses as well. And you know what? I remember when I was almost done school, like after I wrote my board exams in my last year, and I was so tired of sitting in classrooms and studying, I thought, I can't wait to graduate so I can never sit in a classroom again. So I was there. I thought very much the same way. I did decide to do a GPR because I thought it would accelerate my getting confident and comfortable. And the really crazy thing was when I did that, I quickly realized once you graduate, when you learn, it catapults you. Like your confidence from even a weekend course in something that you were curious about. I think maybe because it's optional and you're like open to learning and not forced at that point, you just can do so much with that. So the advice that I would give is don't stop learning. I think you're either growing or you're dying. So if you're planning on stopping, you're just going to stagnate and you're going to become one of those people who's frustrated with dentistry, and you're going to see some people doing really well and you're going to wonder why that's not you. And what I can tell you is if you want to do well in any field, in every business, you have to keep advancing yourself. And even if you just take one course every 6 months, once a year or twice a year, choose something that you're curious about, that you enjoy, that you see that there's more to it than what you're offering, and take one weekend course in it and see what that does for you. Because once you start seeing what you can do with that, you'll realize, like I did, like at some point I started taking tons of courses after I realized how much I could get out of just one course.
So you mentioned clinical mastery, and I love the founders of that, Pete Janicki, his wife Jen Janicki. So to those homies that don't have not heard of clinicalmastery.com, talk about your journey. What is clinicalmastery.com, and why are you on the teaching faculty for them?
So Clinical Mastery Series is an occlusion-based curriculum. So what we teach is we teach dentists how to become comprehensive dentists, how to look beyond one tooth, look at the whole mouth, look at the whole system. And eventually the goal is when we're done, they can confidently do cosmetic cases and rehabs and bigger cases than they could ever do before. So that is really something that changed my practice. There's a lot of different teaching institutions that teach similar things. What I loved about Clinical Mastery is the practicality of it and the fact that everybody who teaches on faculty is actually a practicing dentist, and we're practicing general practitioners. So we can really make it practical and applicable for a GP to be able to do it at home. So that's what that's all about.
So is everything they teach? I guess people listening might be wondering, what do they teach? What do they not teach? Is it basically all restorative, occlusion, cosmetic dentistry? Like they might be wondering, if you learned all this, do you also do endo? Do you place implants? What do you do, and what do you use an extended team for?
Okay, so I'll tell you a little bit more about Clinical Mastery, and then I'll answer the team question. Okay. So Clinical Mastery, we have 3 levels of courses where we teach an occlusion restorative curriculum. And then we have Jason Olitsky runs an aesthetics course. John Nasty runs a full mouth rehab course where you can actually watch them prep and seat cases over the shoulder. Lee Gary runs an amazing photography course. We also now have a sleep course, and created based on demand, I'm actually creating with John Nasty a program called the Brilliant Practice Mastermind, and that'll launch in early 2020. And that is basically about the business training that we didn't get in dental school. So we are really multifaceted, and it's really about elevating our practices from single tooth dentistry to being able to provide comprehensive care for our patients. And now you asked about what our teams look like, and we're all a little bit different. One of the faculty says he prefers to have a super gingival practice. So, I mean, we're all a little bit different. We've got people on faculty who are heavily surgical. So they do tons of implant dentistry in conjunction with the rehabs. But what I'll tell you is we're all doing some amount of regular GP work in addition to the rehabs. For me, I've actually honed in on the cosmetics and the functional dentistry because that's what I love. And I love the reward of being able to actually change a patient's smile by changing their teeth. I didn't used to feel that when I was just doing MOs and DOs. So now I actually feel like I'm changing somebody's life when I do this for the better. So that's what I do. And my extended team involves everything from endo to perio to surgery to anesthesia, because I need all that to work together to be able to deliver what I'm doing and what the rest of the team is doing. Even if the patients aren't getting full arch dentistry, we still try to treat them comprehensively.
So he said I thought that was so funny. He said he practiced limited to sulcular dentistry, or what do you say?
It was just a joke. A supragingival practice.
A supragingival practice?
Yeah, like he doesn't want to see blood. I mean, there's a range, right?
That is hilarious. I've never heard that before. A supragingival practice. So who is your target audience? Who's going to these classes to where they say this is, obviously you're making a lot of people happy because you guys are really busy all over the United States. So who's your target market, do you think?
So I'll tell you, we actually get docs coming in from all over. We do get a good group of people that is constantly coming in from dental town. But mainly they're just doctors that recognize there's more to it. So they're doing the bread and butter dentistry and they're recognizing that maybe there's something missing and they'd like to do more, or they're seeing other doctors doing more and they want to be able to do that. Some of them are practice owners and some of them are associates, and they all sort of have the same goal to elevate their patient care.
Yeah, and on the faculty, who do you think is more handsome, John Nosty or Eric Farmer?
I think, you know what, let's get them on the podcast and have them battle that one out.
The bald guy, he's the most handsome guy on the faculty. I think John Nosty should try shaving his head. You know what, when everybody comes out of dental school and they say, okay, I'm $285,000 in debt, the first question they're going to ask, so I'm going to throw you under a bus for this, do I have to buy a $140,000 CEREC machine to be a cosmetic dentist like you?
So you don't. The answer is no, you don't. You need a good lab technician is what you need in order to do cosmetic dentistry. And what I'll say is that I don't have a CEREC machine. So I've been practicing 12 years. I'm focused on cosmetics. And what I've found for me is that I'll kind of take a step back and tell you, when I first finished my residency, I wore all hats. I tried to do everything myself. I did surgeries, implant placements, specialty procedures, everything, endos, I did everything. And I kind of got to the point where what I wanted to build was a team of people that were individually skilled in what they do best, what they're passionate about, what their superpower is. And that's what enables us to deliver the absolute best care. And for my cosmetic cases, I actually use Gold Dust Dental Lab, and their technicians are incredible. And that's what provides me with the level of cosmetics that I'm able to provide my patients.
Gold Dust, they're right in my backyard. They're in, I think, Tempe, Arizona.
Oh, that's right.
Yeah,
they are.
Gold Dust. You don't have to. So I'm going to go through. There's three things. A lot of them think they can't be like you unless they buy a $140,000 CAD/CAM machine, $140,000 CBCT, and $100,000 plus laser. So let's go down the list. Next is CBCT, then laser. Do I have to buy? Because she graduated, she went back to work with her mom. Her mom's got like this 25-year-old Pano machine, and so does she need to upgrade that to a CBCT?
You know, that's a really good question. And I think at the end of the day, it is practice dependent. And I think you have to do the math. I mean, you're a business person. Every single thing you buy needs to have a return. And so do the math. Like, what's your best case scenario? How many CBCTs do you need in a month? What is the monthly payment? Are you going to make any money, or are you just going to break even? How long is it going to take you to pay for it? Is it going to be totally obsolete by the time you're done paying for it? Like, you got to do your numbers. For me, although I have a very busy practice and I routinely get CBCTs for my patients like every day, I actually refer them to a radiology clinic where I get CBCTs with reports from the radiologist. And I love that. I'm working right in, and I did the course on CBCT. I get them to send me the CTs, so the CDs so I can look at it myself. But I mean, I'm perfectly happy doing that. So do you need all that stuff so that do you need to spend an extra $500,000 on top of whatever you spent on your practice so that you can offer the best care to your patients and do really well and be profitable? No. That is baloney.
Yeah, and the other thing,
that's the truth.
The other thing, I can prove to them with their own behavior. You know, I love pointing out to people where they already know the answer with their behavior on other issues. So why don't you apply it to this issue, like an iPhone? I mean, these guys get a different. They upgrade their iPhone every 3 or 4 years. Do you really want to buy $100,000 CBCT and then use it for 30 years? And you refer it to someone else and they read it for you. That's what they do in healthcare. I mean, if you go to healthcare and they need something, your physician doesn't have it in the office. So you're so smart on these things. Last but not least, a laser. Some of these lasers are $100,000.
So again, I mean, you have to see what your passion is and what works for you. I would say before you buy a laser, take a course. That would be my advice. Get educated. So I wouldn't spend $100,000 on something that I didn't know anything about. I would go learn and see in my patient pool, can I actually apply that? And what difference is it going to make? I mean, hard tissue and soft tissue lasers, you have to learn. You have to learn. And you have to see what they're saying you can do and what you can actually market. And is that actually going to work? So no needles. Right? No needles with lasers. Does that apply to every case? If you say that in your marketing, are you going to do it 100% of the time? I mean, those are all conversations you need to have. Having said that, I have great colleagues and friends who really love lasers and practice with them day in and day out. So I'm not saying that not doing these things is the right decision for you, but I want to just focus on the core of your question was that if you're starting out, do you need all these things? So, be a business person. You are a CEO. Do the math.
And what I have seen, the biggest change in my 30 years as far as civilization's infrastructure is when I got out of school in 87, only rich people could fly an airplane or they work for a big government or big Fortune 500 company. Now anybody, Southwest Airlines, by keeping one eye on the customer, one eye on cost, they gave everyone the freedom to fly. And I think the most important piece of equipment is a digital camera, because I routinely see the people who are taking cameras and putting them on their website and they're saying, this is my own work. I did this. People are finding that on the internet and they're jumping on airplanes and they're flying on Southwest for just a couple $100 to the next town over and having it done. And they're flying out of a town where I happen to know someone as their diplomat in the International Congress of Oral Implantology and is one of the best implantologists in Fort Scott, Kansas. But if you go to their website, you wouldn't even know that they like implants. And so the people who photo document their work and pay, especially when it goes to cosmetics. I mean, I see it all the time. There's a guy out here in Phoenix who's just crushing it in the cosmetic work, and he basically he'll separate anything like a face job or a tummy tuck or whatever into like 3 or 4 major cases, and then he's got like 10 examples of each one of those cases where it's all his own work. And right now his business, Dr. Shaw, it's almost entirely rework. I mean, he doesn't even do someone's first facelift, tummy tuck, or whatever. It's all rework, and they're all convinced by photography. So I know Jason Olitsky, he's big into photography. He works with you guys, but get a camera, start photo documenting your work. Also, I want you to talk about something else. I see a trend where we're going to go back in time. In 1900, healthcare is only 1% of the GDP. There are no specialties. By 2000, it's 14% of the GDP. There's 58 specialties in medicine, 9 in dentistry. Now it's 2020. There's 10 in dentistry. And you have these kids coming out of school and they say, well, I'm going to master everything. I'm going to master endo, perio, pedo, pros. I'm just going to do it all. And you're like, really? We're going back to 1900? How do you tell super motivated Batman that just on implants, I mean, just placing implants, bone grafts, sinus lifts, I mean, you could barely learn implants. And then you're going to do all that on the side with endo, perio, pedo, pros. How do you take some go-getter gangster who thinks 1900, we're going back to 1900, and say, dude, in 1900, there were no medical journals. And now in the United States, there are 40,000 B2B healthcare journals. I mean, take an eye. There's guys in eyes that only do retinas. So how do you have a conversation with a 24-year-old that's going to learn every single thing on earth?
That is an awesome question. And I'm sort of laughing to myself because as you're describing this, I'm remembering myself when I was 24 years old. And when I selected my residency program, I actually chose the residency program that had the least number of specialties so that I could do all the specialties with my own two hands. I'm a different human right now. My new goal in life is to not grow everything with my own two hands because that is limiting me to my own two hands. But what I'll tell you is about that young person who's looking to do it all. I don't think it's such a bad thing early on to learn as much as you can. If you're doing it professionally, ethically, and responsibly. That's kind of the rule in my practice. If you can take on something as a doctor and do it as well as a specialist, because you've trained yourself that much and you're really passionate about it and you want to do the right thing for that person and you can do it well, then go for it, do it. I think what happens when people start to spread out like that, because I did that, is that for me, I started learning that there's actually things I like more than others. And what you start learning as you get older is that you'll have a happier life if you spend more of your time doing what you truly enjoy. And there's very few people who truly love endo, perio, bone grafts, implant placement, sinus lifts, cosmetics, like all the things. I don't know anybody. Actually, I say there's very few people because I really don't like to say never, but I don't know anybody who loves all of it. I know, and how you can test that for yourself is when you get those things on your schedule. Just think, when you see an endo on your schedule, are you like, yes, I have an endo today? Or are you like, oh God, that dreaded hour on my schedule, right? And start honing in on what you actually enjoy. And when you do that, you can take more courses in that and start to excel at that. And then that's where the team comes in, because the incredible thing that you don't realize, that I didn't realize either when I was younger, is that when you have a team of people doing everything that they're passionate about, the service you can provide for your patients and how much you can grow your business is way beyond what you can do yourself, way beyond. So, and that's coming from me. I'm super experienced in doing it all myself, working 7 days a week, relying on only me. I mean, it was crazy town. And I'm in a much better place right now because I grew from there.
So talk about your next journey. You're going to start the Brilliant Practice Mastermind. And now you have two websites. You have your dental office website, allsmilesdentalcenters.ca. And by the way, she is Canadian, so she spells centers CENTRES. So I might throw you off. All Smiles Dental Centers. That's spelled. And by the way, the reason you see so many Canadian British words spelled different than American words is because when America started printing presses, it was paid for by the letter. So everybody started taking letters out. Just like when I got out of school in 87, if you wanted to run a classified ad, it was by the word. So you would just say, hygienist wanted. End of story, but anyway, but you have another website, Dr. Albatish, DRALBATISH. Is that going to be, is your Brilliant Practice Mastermind going to be at dralbatish.com or a whole nother website?
So the Brilliant Practice Mastermind is actually going to be, it's something I'm launching with John Nosti for Clinical Mastery series. So it's going to be part of clinicalmastery.com. It's going to be another page on there. And what we created that for is all the doctors that we see coming to us during and offline after courses, asking all these business questions and the real common things that dentists all struggle with. And so we created this based on demand. And the bottom line is, this is the business training that we didn't get in dental school. We graduated with our DDS or our DMD. And if you got a practice, or if you're planning to start a practice, or even if you've had one for a few years, you are a CEO. And your potential, like I mentioned before, is to run a multi-million-dollar business. And so what we want to do with this is give people the opportunity to create something that's more than just a job for themselves. It's to really think about it as a business and a company and apply real business principles into dentistry. And that's what we've done to achieve our success in our practices.
And what will be some of the examples of the things you'll be doing? You'll be teaching.
So, I mean, let me give you an example of something that many practice owners don't know a whole lot about. Their numbers. Know your numbers. If you start talking numbers, many practice owners have no clue where they stand. They don't know if they're profitable or not. And if they think they're profitable, they don't know how profitable they are. And they don't know what it would be like if their own two hands weren't doing the work. So that in itself is issue number one in the dental industry. Now, if you take routine business training in regular business, the principle is reading financial statements, different types of statements, profit and loss, cash flows, right? And if you talk to business people, even who own dental offices that aren't dentists in the United States, they'll talk about that, your cash flow statement and knowing when you're losing, right? And so what we're doing that's different is that what we're going to teach you is how to know from what's happening in your practice, what metrics, what reports, what things can you look at so that long before you've lost anything, you know you've got a problem and you know how to correct it. And that's kind of the difference of taking those business principles and actually applying them as myself and John have into our practices and creating success with that. And with these principles is how I grew one of the 500 fastest growing companies in the country, which is kind of a big deal. This is not one of the 500 fastest growing dental offices. It's one of the fastest growing companies. It's recognized in the business industry. And what I had to do with that is take business principles and apply them into dentistry and make it work and continue to grow and be profitable. Professionally, ethically, and responsibly.
Congratulations on that. I mean, it's so bizarre. I had a conversation with a graduate yesterday. He's been out of school 2 years, and he says that he believes that dentists as associates should just get paid a flat rate. That way they don't have to worry about anything economically and just do what's right for the patient. It's like, dude, they don't even have that in a Disney movie. I mean, that was never even repeated by Goofy or Donald Duck. Or where does the mindset, like just answer that question? How does someone come out of dental school and think that they live in some Wally World fantasy that associates should just be paid a flat salary so they can just worry about doing the right thing? I mean,
I love the question, and it does go back to mindset. I think the answer is in your question. And I think there's two types of mentalities that we see in dentists. One is an employee mentality and one is an entrepreneurial mentality. And I think that someone who wants to be paid a flat rate so they don't have to worry and don't have to think about anything is really someone who's, signing up for the comfort of working for someone and being an employee. And you know what? I don't really think there's really anything wrong with that, only because there's also the entrepreneurs, and those two people may be able to work well enough together because someone here doesn't want to run a business. But the one thing that I'll tell you that I think people forget about when they're only worried about their own comfort, being, let me get paid a flat rate so I can just be comfortable and not have to worry about anything. You're thinking that this is all about you. You're forgetting that it's not about you. If you want to be successful, you need to be a servant to your patients. You need to be a servant to your team. You need to connect your skills and your knowledge on a human level and give people something that's going to make a difference to them. And if that is your primary goal, patients first, you can't not make it work. That's where success in dentistry comes from. And so that's, so my thought process on, I would never ask for a flat rate myself, because I think that if you actually learn and put in the effort, you can totally blow the ceiling off flat rate. I don't know why you'd want that.
So you say you own and operate a multidisciplinary practice. What does that mean? What is a multidisciplinary practice?
So we have multiple specialties. And it, like I said, it's in a blue collar area. So when I first started the practice, the goal was treat everybody. We were yes to everybody. And we did that. And so there's a lot of bread and butter dentistry happening to this day in my practice. And that's the goal. We do take care of kids and adults, and we do sleep dentistry, and there is single tooth dentistry. But the goal is that everybody on the team is able to look at patients in a comprehensive way. And then anything that patients need that's a specialty procedure, we have a specialist in the office that can take care of that. That's what multidisciplinary is. So we've got an endodontist. We've got, well, I'm doing the ortho. That's one of my passions. We have an anesthesiologist. We have a dentist that's doing the surgery. So all those things come together for us to be able to provide comprehensive care for the patients in the same practice. And people really appreciate that because they get comfortable with us.
So what are all the specialists you have? So they rotate, they come by once a week, once a month, something?
Yeah, it depends on the person, but yeah. I mean, some are once a week.
What are the specialists? You said endodontist, anesthesiologist, you do the ortho. What other specialists do you have rotate in your office?
So we have, our perio is actually off with a hand injury right now, but it's perio, endo, surgery, and anesthesia are the main ones. I take care of sort of the TMJ and cosmetics as well as the orthodontics. And then we've got a team of general practitioners that does the bread and butter dentistry, and they love what they do. And the great thing is that our communication in the office, being a multidisciplinary team, means that we all have access to the exact same records for the patients. So our communication with each other is top notch. If we want to talk to each other, we're there. You can just talk to the person. You don't have to pick up the phone most of the time. So it's really, really a great service to patients. And like I said, patients don't have to go anywhere. So that's really great. And what's really great for me is not everything has to be my superpower. So what I've been able to do over the years is work less and grow, which is, it's my legacy.
And if Ray Kroc didn't do that, then when he died, there'd be no McDonald's. If Sam Walton did that, when he died, there'd be no, Walmart. Herb Kelleher just died of Southwest Airlines. I mean, when he died, I mean, it's just amazing how, if the goal is every year I work 1 hour less with my hands and 1 hour more with my systems, then you can have that, then you can slowly die and your business goes on. But if you die, if someone just blows a whistle and they whistle in a bulldozer to come level your building, then basically you were just noise. So I want to talk about, you have an anesthesiologist come in. It always concerns me when you go into any hospital in the United States or Canada or the United Kingdom, you cannot do the surgery and the anesthesia. They're separated. The only place you still find that is in dentistry. You have an anesthesiologist come in, which I think is the only model we see in all the hospitals in North America. So what do you think about people wanting to go learn their own anesthesiology and then do the anesthesia while they're placing implants, pulling wisdom teeth, or whatever? Why did you choose to go with an anesthesiologist and not do it yourself?
So I love that question. I love the depth of all your questions. I actually took a sedation course. I started learning about sedation in my GPR, and then I took a sedation course, and I'm actually certified to do the sedation myself while I do the dentistry in my practice. And I have a permit for my facility to do that. And I actually decided not to do it. And I have a lot of really good dentist friends, colleagues who are amazing surgeons who actually do their own sedation. So I do think that it's a personal choice. The reason I chose to have an anesthesiologist is because I really believe in people focusing on their specialty. Focus on what you do. Right now, one of my associates is doing all the sleep dentistry, but when I was doing all the sleep dentistry, I really appreciated being just able to focus on the dentistry and not having to worry about anything else that was going on with the patient, and knowing that the patient was being taken care of, 150%, because eyes were on them every second. And what that really boils down to, Howard, is that although I am running a business and money matters, the business is about your profit. What I did first is actually make sure that for myself, to my own standards, and all my associates too, we were all being ethical and responsible and professional in the care that we were giving our patients. And so that's the way that we chose to do it. It works really, really well for us. And honestly, stress is zero. Stress is zero when you do that.
Going back to your business hat, do you, I mean, you were ranked as one of the 500 fastest growing businesses in your area. Do you think having a dental office where it's a one-stop shop, where I can just go there and these other specialists rotate through this singular office, is that your business strategy? Is that the goal? Does that work well?
It's working really well for me. What I love about it, I haven't always done that. This is actually the second practice that I opened from scratch. So I did have one practice before where I got to learn a lot, and then I did it again. And so at that time I was referring everything out. So this was definitely one of my growth strategies. But the other thing that I found is that our communication was so much better with the specialists having access to my software, to my practice management software, being able to look at the history and every x-ray, every note, and us being able to be in the same place. So I think the way this ended up working really well for me is for me to be able to provide comprehensive care and having everybody really working together. And like, we actually have doctors meetings, like we have doctors dinners, and we actually will talk about cases. So it's just something that has worked really well for me.
So talk about the Profit 500 Canada's fastest growing companies, and you made that list. Talk about that journey.
Well, it is a sort of survey that's done all over Canada for businesses that are less than 5 years old. So 5 years is sort of the maximum that you can be. And they look at the companies that are the fastest growing over a 5-year period. And so the journey was, I opened from scratch, and we've been steadily growing every year. And when I opened from scratch, it was just me. I had no patients. I didn't buy. We built the office. And I hired my first receptionist, who also was an assistant. And I hired my first hygienist, and we, slowly grew from there. And as I was treating the patients, doing everything myself, the first thing that happened to me was the first time I had to stay at work till like 10 o'clock at night to do endo to get somebody out of pain is when I hired an endodontist. So, I mean, some of this was, there has to be time that you take out to reflect on what's happening, what you're going through, and how you can improve it. And that was a step that turned out for me to be one of the best things I'd ever done in practice. And then slowly I realized, while the endodontist was working, I could be working, and we could help more patients that way. And so the driver and the motivation from day one has always been patient care, has always been to do the best things for patients. And when the leadership is that way, your team follows suit.
That is amazing. So, back to clinical mastery. Clinical master, you have a lot of, it's kind of like a who's who in dentistry. I mean, John Nossi, Jason Olitsky, Eric Farmer, yours truly, Chris Catalana, Sam Kress, Lee Gary. Do most people do? Is it a certain series? Is it 4 weekend classes? What is your average bread and butter clinical mastery doctor do?
So the average person will start with a level 1 occlusion course, which is our first one. And then we have 3 of those. And we also have a treatment planning course that most people will take to help them actually get cases off the shelf, so that it's not just that you know about occlusion and you know how to balance a bite and maybe how to do the process of veneers. But when people coming in all looking different, you need to be able to give them options and to plan for that, because not every patient is going to fit into like a cookie cutter mold. And then photography is something that we encourage. Like you mentioned, your best tool is your digital camera, and I could not agree more. And so photography is something that we encourage all of our attendees to consider if they want to get into that level of dentistry, so that they can communicate better to their patients and to their team about what they're doing. And honestly, with photography, you can even elevate your own skills. I mean, what you see when you blow something up on a screen is really different than what you see by looking with your eyes, or even with your, 2.5 or 3 times loops, right? So that's another thing. And then once people get through that is when they start looking at things like TMD, the over-the-shoulder courses, which are Jason Olitsky's aesthetics course and John Nosty's rehab course, and then the sleep course. So there's definitely places that you can branch off to, but your starting points are starting with level 1, 2, 3 occlusion, as well as treatment planning. And then
your next one for Occlusion 1 is in New York, but it's sold out for September 20th. The next one, that's in Phoenix, January 24th and 25th, which would be fun to go to because January 24th and 25th, the following weekend in Miami, the Arizona Cardinals will be playing in the Super Bowl. So you could do you could follow those guys out there. She's laughing that she knows that is not going to happen. It could happen. Come on, it's they tied their first game. Keep me in my bubble. So last but not least, I can't believe we went over an hour. So just my wrap up. I'm just gonna my last and final question. They know what they know. They don't know what they don't know. You said something above your unconsciously competent. So they went to all this school. They know so much about perio and caries. She just graduated. She went back to work with her mom. Her mom's why she wanted to be her dentist. Her mom doesn't even own an articulator. And when you start talking about occlusion, I mean, I know my homies. I mean, I know them. If you have TMJ, they call in the assistant. She takes upper and lower alginates and sends it to the lab to make a tray, a night guard. And someone comes in there and does an FA to see if your insurance will pay for the night guard. I mean, that's the limit of occlusion for 9 out of 10 American dentists, period, end of story. And we're not talking woulda, shoulda, coulda, but she's back with her mom. Her mom doesn't own an articulator. If they have any TMD problems, they get the assistant and the receptionist to take alginates and do an FA. Why should they learn occlusion?
Okay, so that's an awesome question. And the reason why you learn about occlusion is because, number one, all the single tooth dentistry that you're doing and the night guards you're making are not all going to work. And as you start to get more into dentistry and you start to get more experience, you're going to recognize that there's going to be things like fillings on tooth number 8. I get these questions on social media all the time. Like, I did an MILB on tooth number 8 and it came off, and then I did it again and it came off, and I did it a third time and it came off. What bond should I use? The question is, what bond should I use? And so when you start asking yourself those kind of questions, usually my answer is that probably has something to do with the bite and not your bond. And so there's going to be types of dentistry you get into that you can't make work without knowing more about why they're actually failing. And if you want to get into cosmetics and you want to get into doing things like veneers and some of the cool stuff that you see other docs doing, maybe that have a little bit more experience, and you don't want that stuff to be breaking on you, you want to do long-lasting, predictable dentistry, you need to learn about how everything works together. And occlusion really is about how everything works together. It's the system, joints, muscles, and teeth, for how everything works together in the mouth to produce the results that work and last. And so do you need an articulator before you take your first occlusion course? I'm going to go out on a limb here and I'm going to say no. I finished school. I had an old Hanau articulator, and I think I still have it, and I don't know where it is. Because what I did was when I started taking occlusion courses and then we start learning using articulators at courses, I actually bought the articulators that we were learning on so I could start to evaluate my cases differently. So if you're not using an articulator and you don't own one, don't panic. And you don't have to go out and buy something. Learn about it first. Get into this so that you know how to set it and how to treatment plan, and then use it as a tool to help you have successful results. So why occlusion? Because it's going to elevate the care that you give to your patients if you want to take a step up.
Well said, Dr. Nada Albatish. It was an honor to podcast you. You can find her at clinicalmasteryseries.com. She's on the road. Thank you so much, Nada, for coming on the show today. It was an absolute honor to podcast you.
I am so honored to be here. Thank you so much for the opportunity, Howard. It was fantastic to meet you.
All right. Have a rockin' hot day.
Thanks. You too.